Naomi and myself and a few others were lucky enough to be at the meeting on March the 9th with the Deputy Director of the DOH, who's handling the homeless. So I thought we would speak to that a little bit today. I know we had sort of looked at educate, advocate, and action. And I know Nancy had was going to be doing some education with some of the church group. And I just wanted to see if that had rolled out and how that worked out.
I'm still, Kaimiki Christian Church is very interested in having me come and do a presentation. That is a church of about 700 people. So I'm just waiting to hear a date from them. Kalihi Union, I still have to hear back from, and I'm working with Palama Settlement right now, try to find a date time.
I think also the we are finding that, you know, there's limited amounts of vaccines, so there's lots of comers at this point to take the vaccines, but they're suggesting that there is a 30% vaccine hesitancy.
Yeah.
And so Beth Hoban had sent around some of the flyers or the education materials that are being used in the various languages. And we had sort of talked about whether it would be of value to do a blitz campaign and distribute these flyers in shops and things in a selected area. Anybody have any thoughts on whether that's an action step we want to be looking at?
Claire, are these already printed, or are we printing them and then distributing them?
We would have to print them. They are on the DOH's website.
Yeah.
And
okay.
They have both the English and the
languages. Yeah.
Various languages. So that would cost some money in printing, but not much. And then it would be setting a date and going out. So that's something to throw out. We can think about that and discuss that further. So there's been a couple of initiatives going right now in terms of the vaccinations. So I wanted just to touch base on the meeting we had with the health unit. Their concern, of course, is these silos of vaccination groups that are popping out. Their initiative right now is they've got a few really good units that are going strong, like the Windward vaccination project that Kathleen is at her home base. As Kurt mentioned, Project Vision is going to be helping to vaccinate the homeless through the IHS. And what the health unit liked about that is they said, okay, we only want the J&J vaccine. We're doing a one-time vaccination for the homeless. And Kurt has got details about, Landis Lum is in. Just in a very timely fashion. So
hi.
Welcome, Landis. I'm Claire Schnur. I'm the chair of this Rotary Health Committee group. And we were just talking about how we as a health committee group can lend support to the vaccination effort. We are a little bit Oahu based right now, although we have Al who's from Maui. But we were just talking about how Kurt had sent a link around requesting some volunteer help through Project Vision for the IHS vaccination effort with the homeless. So I wondered about your perspective on how the vaccination is going to be outreach to the homeless, and whether we as a group could provide some support for that.
Yeah, I think Project Vision previously was doing COVID testing for IHS, and recently started administering both the Johnson and Johnson and Pfizer vaccines to the homeless, and they actually favor the Johnson and Johnson one because it's a one-time dose. You don't have to try to worry about homeless people coming back for a return visit. So yeah, so Dara from the Home Project is very excited about having members of the Rotary Club help with this endeavor.
So are they planning on, how are they planning to get the vaccine to the homeless?
They actually will visit the various locations that the homeless hang out. And I'm not sure whether this actually means going to various encampments or shelters, but sometimes homeless are at encampments that are supervised by the city and county or the Honolulu Police Department. So they've been doing COVID testing for about 3 months, and so I think they're going to go to pretty much the same locations for the vaccinations as well.
Okay. So in terms of outreach for us, who would we be contacting to see what the specific needs might be?
For the COVID testing, vaccinations, that would be Dara, and I believe I gave Kurt her contact information.
Okay. So any other thoughts you have about how Rotarians with a health focus can assist with the homeless and the COVID concerns?
Yeah, actually, there are various possibilities for doctors and APRNs to provide services to the homeless population. One need right now is our nurse at our men's shelter, which is near the Dole Cannery Theaters, is out on sick leave and unexpectedly won't be returning back to work for 3 to 4 weeks. So it would be great if we could have RNs or MDs take her place. She was basically a nurse that did a lot of primary care. And so this could be either assisting a physician who is there 4 mornings a week, or actually providing care, being the PCP, being the healthcare provider, which is actually what Kurt did a couple years ago for IHS Men's Shelter, which is where the clinic is located. So that is one way that Rotarians could provide services to the homeless.
And one of the concerns that always comes up is about malpractice and how that is dealt with when you're
Right.
not an employee of a particular organization.
What we recommend is that the individual physicians or APRNs contact their employer about, number one, working at Sumner Clinic as a volunteer, And number two, can they call the malpractice carrier to cover this community service? And many malpractice carriers will agree to do that under the APRN's or MD's current malpractice coverage.
What would be the situation if we find retired MDs and APRNs among us Rotarians? Would there be an issue as they have carry no malpractice at the moment?
That might be an issue, yeah. So it would be primarily APRNs or MDs that are currently have malpractice coverage. I think it might be problematic if they did not have a malpractice carrier currently. That probably will be an issue. I could ask IHS about malpractice coverage in that situation.
Yeah, because I think most physicians who are practicing right now, it would be very difficult to be providing continuity of care as a volunteer at IHS, whereas perhaps those who are retired might have a little more flexibility for
Right.
for that
That's true.
purpose.
I
I
could
think I have a
inquire and
solution
I'll get
to
back
get around
to
with Claire.
you.
What's that? Sorry?
Yeah, I think I have a solution to get around that issues. So I think because I believe reading from your minute from the last meeting, so IHS going to provide the nurse doing the vaccination, right? So the MD or the Rotarian, what we can do is just to do the screening. So that could sort of take us out of the loop of malpractice, because we just sort of do screening to see where the patient have, if they have any contraindication to the vaccine or if there's any issue, and then the IHS nurses will give the vaccination. So that could lessen our, responsibility regarding the malpractice
Yeah, that's
issues.
true.
Mm-hmm.
Right, exactly.
Yeah, I was thinking more of the hands-on care that
And
you're requesting for the wound care.
What percentage of Rotarians in terms of APRNs and physicians are retired and or have like no active malpractice insurance?
There's a number for sure. I'm not sure exactly, like this committee has just gotten going. I'd say 25%.
Okay. Are retired or have no active insurance.
Mm-hmm.
Okay.
Does that sound accurate to the others?
25% of this committee, or because it's not 25% of the membership?
Yeah, are you asking about membership or just this committee?
I'm thinking more of the Rotarian retired Rotarians who have medical skills in Hawaii.
Yeah, we probably have just a handful.
Oh, is that right?
Yeah.
Yeah, there's not a lot.
Okay. I guess I'm thinking Mike and our group. But
And I think what we can really help is with the organizing and the logistic, because I think that's going to be significant. Those are, I think the most challenging part of organizing the vaccination and the distribution of the vaccine. I'm not sure what support IHS could need from us, but I think we can help them significantly in that area.
Mm-hmm.
And ideally, dealing with the homeless population, I think it's a big challenge because we just don't know what percentage of those population receptive to receive the vaccine.
Mm-hmm.
Whereas if we were to provide, vaccination to care home or nursing home is it's a lot easier that way, because we can go in, the day before, or several weeks before the vaccination, and set up appointments so that we make sure we have adequate supply with adequate demand. With the homeless population, we just don't know, how much vaccine we should bring in on that day, because it's Johnson Johnson. I believe when we dilute, when we take it out of room temperature, it's only have 2 hours before it's expired. So I think the challenge would be the logistic of of the process.
So at the meeting with the DOH, there were a few areas identified by them. There are some well-running clinics, and they have a fairly well-oiled machine where they have a group of people working together. And in those groups, they would expect a volunteer to hopefully go for 8 hours. But what they're looking ahead towards now is perhaps setting up another sort of standing pod in a community that is of need, and having someone take over as Ben was saying, the organization of that. But that's a big effort. There's so what they need from the logistics is, you need tents, you need people to greet the people and direct traffic. You want to be maintaining the social distancing, etc. And then what's super important, what they really need help with, is the actual documentation that needs to happen with the CDC. They use a platform called VAMS, and the vaccine has to be, the person, the vaccine, all the logistics have to be entered into that platform. And it's not technically challenging, but it takes a lot of training to do that with volunteers who are flowing in and out. So from their perspective, they would really like a consistent group of volunteers to work together as a team at a particular location, or what they call go teams, where they've got a group of people who are saying, okay, we're going to go out to this nursing home or this retirement community next Thursday and Friday. And so that team who has already worked together and kind of knows the logistics of it can go and support the vaccinators, because they don't need vaccinators. They have their team there. They've already got their designated vaccinators. They need all the support that goes with the that. Lots of forms to fill out. Language, again, could be an issue. So throwing that out. So one of the things that we concluded with was that Amy Curtis was going to send Kathleen a list of sort of how they saw the DOH felt we could provide support for. But at this point, from their perspective, they do have need, but they want consistency too. Anyone else? Beth, you were at the meeting. Do you have any thoughts, or is Pukia there?
I think they also said that they want to make sure that they have like a consistent group that would be there.
Mm-hmm. And that, I mean, one of the things we experienced this week was, the reaching out to provide the vaccines to the Kapuna, and then they did not get the vaccines because they weren't quite coordinated yet with the DOH. And so I think as Rotarians, we have a couple of options. One would be to try and recruit some volunteers as a group and make those go teams that could be mobilized as the DOH needs it, or support them in setting up a stationary center somewhere in need and providing the support that goes with that. the question becomes, do we really have enough volunteers to mount such a thing? Or the other option is, look at what Project Vision is needing. They there is someone in charge of mobilizing volunteers, and it's just a case of putting the word out, and we sign up as we become available for that.
So Claire, I did put the word out that we were looking for volunteers, and we did actually have 7 people who volunteered for yesterday, the 13th, which was canceled.
Right. Yes.
So there are people who are out there who want to help, and it's with the logistics getting the form signed. So as soon as they give us a firm dates and locations, we can go out again and try and get volunteers, because the ones that they gave us were only 15 people. And I think we can get 15 people to do that legwork for them. The one that was really big was the one on the 18th. That's still not firmed up. They said that the Kalakaua buildings is 3 buildings. They wanted 40 volunteers. So we'll need to see if that's going to happen or not. But we can get the word out and get some volunteers. I don't think we can get 40, but I think 15 we can get.
I like that idea, partnering up with Project Vision and us volunteering with them, because you really need one team that can organize the whole thing, scheduling and getting the number of volunteers and recording.
Okay, so that could be one that we asked Project Vision how many they have, but this other one that we had with Lindsay was with AARP, Department of Health, and City and County. And so that's the one that we're already hooked up with. So that's one. And then we were looking at Meals on Wheels. So Claire, I did talk to Michelle, and they are already surveying their clients. 50% of their clients have gotten the vaccine already at certain locations, but they really love your idea of doing the whole family. And so,
yeah.
So if we can get that survey of how many people per household, and then we can line it up and let Eddie know that we have volunteers to make it happen, I think that's one that we can do, because Meals on Wheels is already halfway down the path with getting the survey.
So, I mean, we as health committee people, my understanding was we really are not the ones who will be doing the vaccines. And that comes from the perspective of the DOH has people to do vaccinations, and the malpractice issues that may go with that.
Mhm.
I don't think that we have necessarily the resources to be organizing going into the homes and organizing things. I'm throwing it out
Right.
for suggestions to people, because I mean, to me, I don't think we can mobilize things so quickly. I don't know. I didn't get
Well,
that sense from this week's efforts.
I think the best suggestion would be to really work with someone like Project Vision, come in as their ancillary helpers, because I even think with that, if we're going to do that, there has to be some sort of training. So we don't come in there and a new set come in there every day, and then they have to train us all over again. There's just nothing worse to take, 45 minutes out of your vaccination time. So that's one thing. I think I agree with you, Claire, that the malpractice issue is very significant. I think to organize this is enormous. I mean, I know what it takes to organize a site, and I think it is beyond the capacity of people in Rotary at this point. So to me, the most successful thing would be to say to Project Vision, okay, we've got 10 people that are a group that are going to go out on, this day, Monday, or this day, Tuesday. We could have every day of the week, a different 10 people or whatever they, is needed. But those people commit to doing it on Mondays, and other people might Tuesdays. And so that you have your group really that are ready, that are trained, that arrive and get to work immediately. To me, that is the ideal situation. But that's my 10 cents here. Actually, that was about 20.
Yes, I agree. Going with Project Vision would be the best. And if you do that, you don't have to be a APRN or MD. You can be a non-healthcare provider, and they could train. You could be trained to do intake.
Yep.
Yes.
The other, the other one though is the one with Lindsay with the Kapuna. I mean, if they're trying to get that a little bit more organized, and so that is also an option, because so I think what we need is more details from Project Vision as to, are they doing it on certain days? Because I know a lot of the centers are doing their vaccines 2 days a week or 2 half days a week. That might be the case with Project Vision. And then we could also maybe supplement the Lindsay's effort with the Kapuna vaccine outreach.
Yeah, by the way, my phone is 10%, so if I hang up, it's not you. But,
take it personally.
yeah, I think Project Vision has certain days. They know in advance that they're going to be at this location administering vaccines to the homeless. With regard to IHS services to the homeless, could also be something as easy or hard as patient navigators. For instance, we have a lot of homeless who are not very with it. They're cognitively impaired, and they need to go to the Quest office to get health insurance, but they just don't have it all up there to do that, or they have to go to the Social Security office to get an ID, and having what they call patient navigators to help the patient go to these appointments might be something that Rotarians may want to get involved with, and likewise does not require you to be a APRN or RN. So I'm just throwing that out there. And then was there also the possibility that Sumner Clinic may be able to have APRNs or RNs available to help replace our RN who is on emergency leave the next 3 to 4 weeks? Is that a possibility, at least for those who have current active malpractice and can ask their employee, ask their malpractice insurance carrier if they could be covered for doing volunteer work?
What would be the hours and days that would?
Our clinic is open 24/7. Well, I take that back. We're open 7 days a week between 8 a.m. and 5 p.m. So if a person can, could take 2 hours or 8 hours, that would be wonderful to help replace Elizabeth, who basically is a RN that also did a lot of primary care. Kurt Dalkin actually did volunteer as a provider at this clinic on Sumner Street near Dole Cannery a couple of years ago, and he was an independent contractor, and it was no problem with his malpractice carrier to volunteer to work at this clinic, and he did actual primary care. So he would diagnose and treat medical conditions, and that was okay with his malpractice carrier. But we would also welcome RNs who would just, you know, act as an RN, supporting physicians in the morning, or, you know, or volunteering whatever time they could, 7 days a week, anytime between 8 and 5.
And for the
So
wound
Dr. Lam,
care, sorry.
so Dr. Lam, quick question. Does IHF not have the funding to hire locums? Or should us Rotarians do what we do best and write checks to support them in terms of them hiring locums?
Right now, they're pulling. We're probably going to cut clinic hours rather than hire locums for replacing the RN.
Right, but I think, you know, most
And
of us Rotarians, we could write checks and support the hiring of a locum, at least for a
Oh, yeah.
day.
That would be an option also,
Something
yeah.
sensible for us to do.
Yeah, that would be an option. That would be great.
Where does the funding come from for this facility?
It's some of it comes from HMSA. Much of it comes from donations. Some of it comes from the city and county. So there's funding. IHS funding is a wide variety of sources.
You know, Claire, Dr. Lam actually came up an interesting point, and it's something I've been thinking of, that maybe there are more Rotarians who wouldn't mind taking that kapuna from their home in Manoa and taking them down to Pier 3. I don't know if we've asked all of the big locations that you have calls with people who want to come get their vaccination, but they have no transportation. I could do that tomorrow if, you know, we need be, and I don't need any special training. I'm just not sure in terms of the liability of us Rotarians having a, you know, private citizen in our car, but I would go pick up someone and take them to Pier 3.
Yeah.
Just wondering, maybe do something simpler.
Yeah. Or when the vaccines start rolling out in the pharmacies, to take them to their local pharmacy.
Sure.
Or their local community, because I know at KKV, which days are you guys immunizing at KKV?
Friday.
Friday mornings?
Friday day. Yep.
All day Friday. So that is a good thought, a good initiative, but again, it's too bad we have to always come back to liability, isn't it?
Very sad.
It is.
It's a fact.
Yeah. Okay, so let's just sort of, I mean, Dr. Lam has made some good suggestions as to where their needs are. I'm just wondering too, if we can sort of put together some ideas moving forward so that we can participate in the vaccine effort, which seems to be of interest right now. So we've talked about the project vision and reaching out to them and finding out what their specific needs would be, and if there are specific days that we could recruit volunteers for. And then there is the other with the Kapuna, who have been are working very hard to come up with particular days which have particular language requirements. So me not being the greatest at organizing, anyone have any thoughts on how one would organize these groups into effective outreach, like our group to outreach to these people? Like
I have one comment. It's not to respond to your question, but I think one area that Rotarian can help is to provide support in the registration. So I went over the Rotary website, and I think Dr. Josh Green he sent out some slide, and I went through the slide, and there was some site that allow people to go up and register themselves for the vaccination with certain clinic around the island, and I go into those websites. It's very hard to navigate, and so it's even for me, someone who's somewhat competent in IT, it take a while for me to navigate those websites. And so I think it's going to be a challenge, especially for the Kapuna, to go in and try to register themselves for a vaccine or make an appointment. I think that is something that we can set up a booth like in the mall or somewhere, and can have people sign up for those vaccination. I think that's one easy, task, but then it's challenging for the Kapuna. That's something that we can do.
Yeah.
And I don't know if Hawaii have a registry, because right now a lot of people haven't been vaccinated. So it's easy, just go out and grab people and say, hey, you need vaccine, and give them. But then ask more people get vaccination. I think the logistic part will be a lot more challenging. So there should be I think, in my opinion, I think there should be a registry for just anybody who interested to get vaccine, just sign up in advance. And then the clinic can just go into that registry and say, okay, this person above 60 years old, and they haven't been vaccinated, but they want to get vaccinated. They can reach out to those people and, make an appointment with them. And then we just go down a list, 60 years old, 50 years old, 40 years old. I think appointment, it have to have an appointment system, because, this vaccine, it have such a limited lifespan. So in order to prevent wastage, have to have a appointment system so that we know exactly, how many people will show up on that date and what time. So we have the adequate amount of vaccine. If we were support with the project vision or any system, I think there should be an appointment system. And then I'm not sure what structure that they have regarding recording and uploading those information. I think with the homeless, it's going to be so challenging, because I don't know if they have ID, where, okay, this is Mr. John Doe. He, how many years old and got vaccine on certain day. I just don't know too much about the homeless population. So, so that's just some thoughts.
There are some high school students that are doing that, and I can't remember which school it was, but it was on the news the other day that they're actually helping the older people register for COVID shots. And that actually, not to get more complicated here, but it would be a way to use Interact and Rotaract students. But I'm just thinking about how we would do that, because I know you mentioned the mall and we could grab people in the mall. Number one, there are not a lot of people in the mall, but number two, I think the elderly and the people that we're looking at are staying home, and they don't have access to getting to the mall. So I think that becomes a real challenging question as to how to reach them. Yeah, and I could reach out to a school or two schools and ask them, are you doing anything? And if so, what are you doing, to see if it might even match with some of the things we're doing. And just on another note, I'm certainly willing to make flyers and take them to places around the island. The challenge is, you have to make them in Burmese and Chinese and Japanese. There's not one flyer that has multiple languages on it that I have seen from DOH yet. And that becomes a big problem. I know when we did it, we had one big giant flyer with different languages, but anyway, I'm more than willing to do that, but just some thoughts.
With Claire reporting in what my task was from the last meeting, I checked with community leaders in the Chinese community, and they don't anticipate any problems amongst the Chinese speaking population. They're waiting for their vaccination. They're going to get it. They'll have their grandkids sign them up. And I just had a chance to talk with some Japanese community leaders, and the Japanese speaking population are not reluctant to take the vaccination. So they're likewise, I don't think we have a problem with both ethnic groups. I think they're just waiting for their time to make the appointment and get vaccinated. So what I looked into was whether or not there was a need in those two populations, and there actually is not any.
Good. Yes, that's excellent. Thank you. So I think though, just following up on what Ben said, I mean, perhaps that's a place where assisting people in their communities, like through their churches or setting up a booth in a church or a grocery store where they're, you know, they have the hours that the kapuna are able to come in, because that's absolutely right. It's the registration that is the biggest stumbling block. So that I think we should really think about, and that's where we can reach out to other Rotarians, where when we identify a place that you know, it would be like a Sunday or something, that could be done. So that's a good initiative. Okay, does anyone else have any thoughts?
I was just thinking if we need, I can probably call the contact at Project Vision, but I wouldn't be able to do it to Thursday or Friday and see just exactly how they could utilize this.
Yeah.
And they could set up, you know, and what
Yeah,
they're
but-
looking for as far as like consistency with the group. I mean, I'm available easily every other week. The week I'm working, it's hard for me to have any availability, but I'm sure if we got some kind of rotating schedule with that, it shouldn't be that hard, especially since, like we said, they're not going to vaccinate 7 days a week. It's just going to be on, you know, Wednesdays and Thursdays, probably for a half a day or something like that, you know, so, you know,
I
and
can
if we're
text.
moving to different locations, you know, that's not a problem, you know, as long as everyone has had, you know, how do we get the proper training to use what you were saying, that
VAMs.
VAMPs, you know, and how do we, you know, get proficient at it? Then it doesn't really matter if we're different people, as long as we all know what we're doing. And, you know, we work well, you know, you can always work well with I can work well with anybody, you know. But
And
if,
the VAM system, they will have a like a little training module that you can do on your own computer before you go, so you know kind of what it looks like.
yeah, so like I can't give consistency and say, yes, I can be there every Monday. I can say I'll be there every other Monday, you know.
Kelly, did you?
Well, yeah, I was going to say, I mean, I work close with Dara, so I can text her tonight and email her with kind of a capture of tonight. I apologize, I was a little late getting on. I had we have a state flood response call that went long tonight, so I apologize. I missed the first half hour of our discussion, but
So what we're looking for right now is, we had talked about the kapuna and the Project Vision, and finding out from them what days they might need us, so that then we can reach out and get a consistent group together who would commit.
I can take that and get that done tonight. I'll reach out to Dara. So.
Fantastic.
You know,
Is that the way the group wants to move forward with this?
You know, Kathleen works with Project Vision every day, and they seem to be pretty organized. So it would be good to see what they need, but with the AARP, the county, and the DO, each one group with Lindsay, they need the help. So if we could split it, but maybe help Lindsay more, I think that would be good.
Yeah. Yeah, we need a little bit more. I don't think we can throw this together last minute, you know, it's challenging. So she had said that she was going to come back with us with more consistent dates, and that, looking at the week of the 22nd. So they have to get the assurance of their vaccinations, and then the site that they're going to be at, and the date they're going to be at. And then we can, as soon as possible, push that out to Rotarians. Because I
So
think
the
it would be
20
very
so the-
exciting.
So the 20th is still on hold?
Yes, it's still on hold.
Oh, okay, I got the volunteers on the Waiwa side were ready last week, and then I need
I
to,
know.
okay. But
It makes
one
it
last comment, I know the last time we talked about the Meals on Wheels situation, and maybe right now, if the Meals on Wheels people could ask the people receiving the meals whether or not they've had their vaccination, we could get good data from that in terms of if 50% of the people getting the meals haven't had a chance to get vaccinated, then that might be a vehicle for us in terms of planning that we could actually do something about that population. So right now, it wouldn't hurt them to do some asking for us.
Hawaii Meals on Wheels does that. They do ask, they've been making calls actually to ask if people have been vaccinated, haven't been vaccinated, and if they're willing to receive a vaccination.
Yeah, so they already are doing the survey, but they were only surveying their client. The idea of surveying for the whole family that Claire brought up, Michelle thought that was a really good idea. So they would need to go back to those clients and see if the family also needs. But if the Department of Health is able to give us the vaccinators, we can find the volunteers with Rotarians. But also there was a group of 30 Kupuna and Kukua volunteers that were delivering meals. They are merging with Meals on Wheels, and so we could tap into that group of volunteers as well.
The other important part of the volunteer effort is anyone who does volunteer consistently at a program will be eligible to get the vaccine. So, I mean, there might be some hesitancy because people aren't vaccinated, but if they know that they're going to get vaccinated, there may be other Rotarians interested in moving forward. Okay, so let's wrap up for tonight. So Kelly's going to reach out to Project Vision to see exactly what they've, how we can volunteer for that effort. And then hopefully I will reach out to Lindsay again, or Naomi can, both of us can, to find out if they have dates set aside and whether they are going to be getting a consistent vaccine allocation, and then we can try and mobilize those individuals of different language to reach out to that group. And then the initiative about helping with the registration of Kupuna at certain sites. Is that something we want to pursue as well? So perhaps everyone could think about churches or groups that might, or grocery stores or whatever.
Yeah, I'm gonna see if I can do that at a Kamiki Christian, as I said, start there. And on these translations of the questions, pre-vaccination questions, they're actually everything that we would ask people. So, you know, you can have them read this, and then certainly you would know that before you even can register them or would register them. But I'm going to look into that part and continue to just educate right now. And, you know, copy these as I need to off the DOH website. Because I'd like to take some into Palolo and some into, you know,
So
multiple
perhaps
areas.
it might be worthwhile to sort of buddy up with someone, Nancy, and get some experience, and then those individuals will feel comfortable going out to a different identified site.
I'm going to ask, so when I get back to you, I'm going to waiting to actually give the presentation to Kamiki Christian, and then to ask them if I can actually register people there. So I don't know that yet, but that may be an option. They just started church on Friday. for the first time. And as I saw it online, there were like, not a lot of people, but I've been answering a lot of questions. I know that. So it's a good place to do a test spot.
And
you know.
yeah, yeah, for me, I'm usually free on Saturday and Sundays. So you know, if anything that I can help, I'm always happy to help.
Right.
And then if Rotarian decide to put together a team, you know, and do it on our own, I can help with the organizing and logistics as well.
Yeah.
Yeah, but Saturday and Sundays are the only 2 days that I'm free.
Because I think more people are available on Saturday or Sunday too. So maybe we should look at that, Ben, as an initiative where we have a go team that can be mobilized on a Saturday.
Yeah.
And find out who is doing vaccines on Saturdays, and then that team can provide some continuity.
So Nancy, you're doing this online for them or by paper?
I would, so what I would do is I've seen this, there are like 13, 15 languages, whatever there are on DOH, and they're really asking the pre-vaccine questions. So I would copy that and laminate each one of them. And then I'd let them read it. Although I'm not going to have that big of an issue with all these languages in Kaimiki. But if I move into Pololo, I will, with Marshallese and Tongan and multiple other languages. But then I'm going to try to see if I can register people. Now that becomes a question of, do they want to give me their information? You know, that's a big question.
Right.
Because I'm in that congregation, they will feel comfortable with me. But that is where we could mobilize Rotarians that are in other faith-based locations, whether it's temples or whatever it is, synagogues, to go in and do this. I mean, I think that makes a lot of sense. And then we could, once we're in that church or synagogue or temple, we could say to the lead pastor or the lead whoever, do you have someone that could assist with driving people? Because again, they're gonna trust their own before they're gonna trust us. So just some thinking I'm doing here as we're moving forward. I've always thought that was a good vehicle and mechanism to get people in, is through already established organizations that people trust.
Okay, so I have these vests that says Rotary on it. So if you want to use those, I've got about 10 of them available.
All right. The other thing about the registration, if you had a tablet or something that you could take and register them right then and there, they'd be
I would take my computer, definitely. And I just have to, you know, get into their Wi-Fi, which they'll let me in. It's not a big deal.
Right.
But I will talk to, I'll talk to them tomorrow.
Okay. Anybody else have any thoughts or? So we're going to look at Project Vision. We're going to look at the Kapuna for supporting them with a group of people who could come in consistently and assist in the vaccine effort. And we're going to outreach to help with registration of Kapuna in any way we can through any organizations or faith-based organizations we have. And then, of course, the IHS is very needs a lot of support, especially in the next 3 weeks where they're out one practitioner. So we need to look at our malpractice to see if we're able to do that. And then any hours that we can provide them would be most appreciated. Okay, anything else for? Great. Well, thank you so much for coming. Does this time work for people? Is this preferred to a morning or?
It, I might be a little late. We usually have baby. It's just she's potty training tonight, so we don't have her this tonight, which is the first. I'm sure you all wanted to hear that, but it is interesting. I just will give you this note: how the young people toilet train their children now is so different. Whoa. Anyway. I know you probably didn't need to hear that, Claire, but a little humor for the end of the night. So I was blessed tonight and I didn't have to do that.
Okay, so we'll just keep communicating through emails as to where the efforts are needed, and then maybe we'll think about getting together in a couple of weeks.
Good.
Sounds good.
Okay,
Sorry, Claire,
Thank you.
it's Kelly. Kelly, one more time. If there's anything that needs to be printed, laminated, color, black and white, of any volume of note, you know, my company can certainly cover that. And again, I've got some gloves, masks, and face shields if we have folks who are in need of that when we start going
good point.
live. I've got approval to dig into our stores for a little bit of that, and we'll see it, you know, what that burn rate looks like. But I think there was another follow-up with Department of Health that Naomi had mentioned that was maybe needing a bit more coordination or support than did Project Vision. And I wasn't familiar with who those sources were, but we certainly work with DOH a lot as a health plan. And you know, I'd be happy to follow up through Kathleen with Eddie, or, you know, if there's another contact that we want, who we've started this conversation with, to take that as a follow-up as well.
Yeah, so Amy Curtis was going to give Kathleen a list of how
Okay.
we could perhaps mobilize ourselves to help with vaccine efforts. So
Okay.
I think what we need to maybe do as a group, I mean, Ben has indicated that he is available on the weekends, but maybe as a group, you could all, if you do have availability and want to form a go team, what day of the week you might be available, so we can sort of formulate our own little go teams.
Mhm.
So when the DOH gets back to us, we can say, yeah, Saturdays work great. We've got this team.
Mhm. That's good.
Okay, so if you could feed back to me, and then we can send it out to the bigger Rotarians when we have more of a structure in place as to what days they need people. Because yeah, as you don't need medical people, you need people who can help with the other tasks. Okay,
I mean, do we want to put together like a doodle or a calendar in Google that people could just, you know, indicate blocks of availability so that we could start to identify what those clusters might look like?
you know,
of
Kelly,
folks?
at the beginning I was saying, I have no idea how to do that kind of organization.
Oh, okay.
So if you have a
Okay.
platform that
Yeah.
would make that happen, that would be awesome.
Yep.
Well,
Yep.
for the volunteers, I had it on the district website, and so I did send the link out in the newsletter, and we could do that. I took it off, but we can put that up with the dates, and people can volunteer for certain dates on the district website.
So are we going to do that with Kelly, or are we going to do it on the district website?
Well, Kelly's one, I think, is with this group on when we're
Right.
available, right? But when we go out and we have firm dates, that's where we can get the volunteers to go to the district website to sign up.
Okay,
Let's just stick with the district platform since it's already going, it's already up and moving. We can just keep annotating there. It sounds good.
okay, that sounds good. I think what I'd like us to do as a group too, we each have our own home Rotary clubs, because I wasn't familiar with the district website, but if we can have the dates and reach out to our groups and tell them to
Yeah.
go to the district website to sign up and give them that link, that would be most efficient. But I'd still like to know when our group is available, if there are certain days that they see themselves being able, perhaps in the next couple of months, consistently to be available for a particular day.
Yeah.
So just maybe shout out, give me an email if you think you were able to do something like that. And then we can even buddy up for certain initiatives.
And Kelly, Ms. Nancy, I'm maybe contacting you because as I'm looking, there's a fair, if you're going to register people, there is a fair amount of, there could be a fair amount of paperwork that the individual should have once they're registered, that being what to bring to the site, for example.
Yep.
You want to make sure that when they come, they're prepared. So I
Yep.
just thought I'd tell you that I may be reaching out to you. I'm gonna see, I'm gonna check and see if I can do this first, and then I'll probably reach out to you. Thank you.
Yeah, I was gonna say, please don't hesitate. We our office copiers are getting dust on them since everybody's working at home.
Okay,
So-
great.
Thank you.
Okay, thank you.
Okay, great. So, yep, we'll keep in touch through emails and then plan another meeting in a couple of weeks. Oh,
Great,
there's-
thank you, Claire.
Okay,
Thank
you.
you.
Cheers.
Thanks,
Okay, great.
Claire.
Thank you. Have a good night. Have a good night.
Thanks,
Good
Brian. I
night.
got the email too. Thanks.